So today I want to talk about medication treatment options for chronic spontaneous urticaria. So your doctor most likely will start you on an over-the-counter H1 antihistamine such as Zyrtec, Xyzal, Allegra. They prefer non-drowsy, so something like Benadryl is really only to be used like if you're having a pretty severe flare and you need to calm that down. It's not preferred treatment for like an everyday long-term use. So we're going to be looking at H1 antihistamines. Usually they wait about 2 weeks, see how you're doing. If you're not having results from those, they can increase the dose up to 4 times. You're not going to be playing with these medications on your own. You need to be working with a physician to find out what dose and what medication works best for you. Another option is that sometimes they add in an H2 antihistamine, and what that means is that blocks the histamine receptors like in your gut. So think Pepcid is an H2 antihistamine. So H1, H2 antihistamine, if those don't work, then we're going to be looking at their injectable biologic, like Xolair. Most people see relief pretty quickly, but they can take up to 6 months to work. Some people have to take higher doses, so it can take a little bit of troubleshooting. And some people still, unfortunately, do not see any relief, even with the Xolair plus H1, H2 antihistamines, all those combined, they're still not getting relief. And then we're going to be looking at immunosuppressants such as cyclosporin. So, and this might depend on your subtype of hives too. Some people, autoimmune hives versus autoallergy, and the autoimmune sometimes can be a little bit more stubborn to treat. So that might be where you're starting to look at those immunosuppressants. And then steroids. So, you know, you might get a steroid pack. A lot of us have a steroid pack like as a PRN to be taken like only during a severe flare, and that's just to put the fire out and get everything calmed down. So, you know, steroids are like a short-term use, preferably just in a severe flare, just to get those symptoms under control. They have a lot of bad side effects. You know, sometimes it's really hard to recover from those. So steroids are not the preferred treatment, but if all these other things don't work, then you may end up on long-term steroids. And if that's what you have to do to, you know, keep your symptoms at bay, if that's what you have to do if you've already gone through all these other steps, H1, H2, your biologic, your immunosuppressant, if steroids is where you end up, and that's what you have to do to keep your hives under control and maintain your quality of life, that's okay. Sometimes, you know, we have to do that, and it's just making sure that you're taking the right steps and you're going through all these options before resorting to long-term steroid use. Like I said, make sure you're working with your doctor on this. H1 antihistamines at the standard dose. If that doesn't work, H1 antihistamines up to 4 times the standard dose, plus adding that H2 antihistamine like Pepcid, looking at adding biologics like Xolair if those aren't working, and then moving on to immunosuppressants such as cyclosporin, and ultimately steroids if we're having a severe flare or if none of these other medications worked for you, just so that you can live your life and so that you can get that quality of life back. So I hope this is helpful. Subscribe if you want more videos like this, and let me know in the comments what medications worked for you, or are you still in that phase of trying to figure it out.